I can hear you.
Okay, great. Good morning, everyone. It is my pleasure to be the first to welcome you to our webinar today. You are here today because you want to learn about how to work with your pregnant patients to prepare and respond to disasters. This webinar couldn't be more timely. We are about to start hurricane season. We are already in the middle of ozone season. And just a couple of weeks ago, we had a flood event in the northern suburbs of Houston and Harris County. My name is Jennifer Hedaya. I'm the Executive Director at Air Alliance Houston. And on behalf of the March of Dimes and the Collective Impact Initiative in Houston, I am pleased to welcome you. With the Collective Impact Initiative, we believe all people in Greater Houston should attain optimal health in all phases of life, including healthy birth outcomes. Let's begin with a little bit of housekeeping. As you can see, we are in a Teams meeting rather than a webinar format. We know how important it is to be able to network and see other participants, so we've allowed that to happen. However, we ask that you please remain on mute throughout the program to minimize the noise for the speakers and for the participants. We also encourage you right now to use the chat function to introduce yourself if you haven't already. Let us know who you are, what organization you're affiliated with, and what part of the state you're coming from today. We then ask you to use the Q&A box, which is at the top of your screen next to the chat function, but it's separate from the chat function, to use the Q&A to ask questions you may have throughout the webinar. We will try to answer all questions as we are able, and we hope to have time for Q&A at the end of our program. We may even be able to take some questions live. We will also send the recording of this webinar along with the presentation. So feel free to share that with your colleagues and those who are not able to join us today. This webinar is approved by the Texas Department of State Health Services for 1.5 continuing education credits for community health workers and community health worker instructors. If you are seeking credit, be sure you stay on the webinar for the entire duration of the event and answer the post-training questions. And then allow us about 2 weeks after the webinar to receive your certificate via email. So a reminder of our learning objectives for today. They are twofold. We hope that by the end of this webinar, you will be able to describe how disasters affect pregnant and lactating individuals and demonstrate how to prepare and talk with pregnant and lactating individuals in anticipation of and in response to human and natural cause disasters. When you registered for the webinar, we asked you, what is your knowledge about working with pregnant and lactating people and preparing them for a disaster? The collective score on a 5-point scale was 2.4 out of 5, right around the middle. We hope that as a result of your participation in this webinar today, we will see that increase across the board. And as a result, you and your patients will ultimately benefit as we go into upcoming hurricane and ozone seasons here in the Houston area. So next, we're going to start with a little bit of stage setting, and I'll spend a few minutes talking to y'all about the concept of disasters, how we frame disasters, and what some of the unique considerations will be for pregnant and lactating individuals in different types of disasters. To start, though, I want to share briefly about my organization, Air Alliance Houston, and why we're here with you today on this topic of disasters and pregnant people. Well, Air Alliance Houston is the longest running advocacy nonprofit solely dedicated to air quality in the Houston-Harris County area. We believe that everyone has the right to breathe clean air. And the quality of our air has a unique impact for people who are pregnant, people who are lactating, and of course, for very young people, babies and toddlers. In fact, pregnant people and young people are some of the most susceptible groups to poor air quality. Next slide, please. In 2019, several folks on this call will remember and recognize this image. There was a major disaster here in Houston very much related to the work that Air Alliance Houston does. This is the ITC Deer Park fire. You may recall their facility in Deer Park caught fire. They housed petrochemicals in their storage plants, and that fire burned for 5 days straight. We learned after the fact that air toxics like benzene lingered in the community for several weeks after the fire. Fires cause soot pollution. The chemicals that were burned put other kinds of carcinogens into the air. And at the end of this, it completely changed our understanding at Air Alliance Houston about our mission, which is air quality. It changed what we needed to consider when it comes to our advocacy work. And as a result of that, we added a priority on chemical disaster prevention to the work that we do, knowing that those kinds of disasters have a direct impact on air quality and people's health. So why discuss disasters? This is almost a rhetorical question for those of us who live on the Gulf Coast. I think we know this, but as a quick reminder, in the greater Houston region, natural disasters in particular have become more frequent, more dangerous, and more costly. In the last 30 years, you can see the chart on the right-hand side is the total number of officially declared disasters. I will clarify though, or caveat, other kinds of events happen to us here in the Houston area that may not raise to the level of a declared emergency. These numbers only reflect the declared emergencies. And you can see them in order. Rain, thunder, flooding events like the one we had a couple of weeks ago, hurricanes, tropical storms, fires. The one public health declared disaster, we all know what this one was. That was the COVID-19 pandemic. And the one declared severe winter storm disaster, we know that one too. That was Winter Storm Uri. Next slide, thank you. But there are some other kinds of disasters that happen uniquely and frequently here in the Houston area. And I gave you one example. That was the ITC Deer Park fire. The Houston Chronicle reported several years ago that our region has a chemical fire explosion or leak every 6 weeks on average. And you might wonder, why is that the case? Well, it has to do with the proliferation of industry in the Houston-Harris County area. Anyone who lives along the ship channel lives and breathes this every single day. The Houston area is home to almost 50% of the petrochemical industry in the country. And all of that industry has the potential for a fire, an explosion, or a leak. And you'll see on the chart on the left, that is the ranking of states for the number of chemical-related incidents in a 2-year period, and Texas is number 1. And much of that is because of the industry we have here in the Houston area. So our risk of chemical related disasters is unique to us here. This is not true for every place across the country, but it is something we have to take into consideration as we prepare and respond to disasters. So a few high level points to be made. Our natural disaster risk is high and getting higher. Our population is particularly vulnerable to the impacts of disasters. We have quite a number of criteria here in the Houston area that indicate the social inequities that are happening in some zip codes and some neighborhoods. So some of our communities already have a deficit when it comes to infrastructure, when it comes to the ability to prepare for a disaster. And so when that disaster strikes, the third point, our ability to recover is inequitable. Some of our communities cannot recover as quickly, and so that deficit in infrastructure and resources just continues to grow. Next slide. Let's talk a little bit about how disasters impact us, and we'll start generically with how disasters impact everyone. And then the next slide, we'll talk about how disasters impact pregnant and lactating people in particular. Some of these headlines explain these impacts: mental health impact, lingering air toxins in the air, the impact of Winter Storm Uri on disaster recovery. So there are several immediate harms in a disaster, and then there are long-term impacts from a disaster. The immediate harms, we know these, we have lived these. There may be loss of life. We have to say it. It's not pleasant and we don't welcome it, but it does happen. People lose their lives during disasters. But we may also lose housing. We may lose property. We may lose basic needs. We may lose our jobs because we can't get to work, or perhaps that job disappeared because of the disaster itself. There are acute health effects. People get injured. There can be heat effects from a major heat event, of which there are more and more occurring frequently. We may have to evacuate. We may have to shelter in place. That's what SIP stands for. And all of those things contribute to have an impact on mental health. They may create fear, anxiety, stress, sadness, and an overall sense of lessened safety and security in our homes and in our communities and in our cities. But there are long-term effects from disasters as well. We may lose livelihood or financial security because of the loss of employment or the loss of a home in which we have invested. There can be disease outbreaks that come from disasters. There are many known disease connectivities to flooding and mold in a home. We may be displaced. We may have to relocate. We probably all remember what happened after Hurricane Katrina and the number of New Orleans residents who had to relocate and start their lives completely all over again here in the Houston area. That has long-term impact. Loss of mental well-being or post-traumatic stress disorders. I have friends and family, you may as well, that anytime they hear dripping or anytime they hear rain, they start to have a fear response because it reminds them of Hurricane Harvey. That is a real long-term impact from a disaster. There's environmental damage. I've talked about air quality, but also to water and soil quality. And there can increase there could be an increase in social disparities, as I've already explained. So what's unique for people who are pregnant and lactating during a disaster? They experience all of those things on that slide, but then there are some other potential immediate and long-term impacts to someone who's pregnant or lactating. Number one, there can be pregnancy complications in a disaster from the stress of the disaster, from lack of access to their prenatal care, depending on the stage of their pregnancy. There can be complications to a pregnancy that are very real, and that could include early labor or even pregnancy loss. There can be an increase in pregnancy-related stress conditions such as preeclampsia or high blood pressure or postpartum depression symptoms, again, because of this external context of managing a disaster while also managing a pregnancy. There can be infant health complications for reasons we've already described, because infants are also very susceptible to the impacts of disaster on air, to the impacts of disaster on water, having clean water to drink or to mix with formula if someone is formula feeding. And there can be a lack of access to childcare if parents have to work or parents are trying to rebuild their home, and then who will look after children during that moment. And there can be interruptions in infant feeding. I've already made reference to it. There could be interruptions to chest feeding because of stress, because of parents' ability to create nourishment, their inability to eat enough. There can be interruptions to creating bottle feeding because of a lack of clean water. All of these things may be happening in the immediate moment of the disaster. And then some of these repeat themselves in the long term. Someone who's pregnant who develops preeclampsia during pregnancy can continue to have high blood pressure concerns throughout their lives or at a future pregnancy, or will be managing mental health concerns. There can be epigenetic impacts. Epigenetics are when our generations are impacted by trauma through genetic changes in our bodies. An infant exposed to stress hormones or a fetus exposed to stress hormones during pregnancy could then develop future concerns later in life. And I believe there is some education through this program around adverse childhood experiences that will talk more about the epigenetic impact. And then there can, of course, be infant health conditions, long-term and nutritional impacts from a lack of ability to feed or eat healthily during or immediately after a disaster. So all of this is to say that pregnant and lactating people have a unique impact from disasters in above and beyond what those of us who may not be pregnant or lactating at the time are also managing during a disaster experience. I want to close by just providing a framework around how we approach disasters and how the rest of our speakers will talk about disasters today. And that's something called an all hazards approach, meaning that when we plan for, prepare for, and are ready to respond to disasters, we look at it as through the lens of any possible kind of hazard. We're not only planning for natural disasters or human-caused disasters. We are implementing responses and plans that could respond to any type of disaster. So it's important to keep in mind the types of disasters that are out there. And as you are educating patients, educating yourselves, that you are planning for all types, because truly at any moment, any one of those types could occur. We also like to contextualize all hazards as those that are also integrated to each other and contribute to each other. So they're not always separate things happening. Disasters can happen, multiple disasters can happen at the same time. You can have a weather disaster at the same time that we are managing an outbreak disaster. We have experienced that. But some of these types of disasters also contribute to and are exacerbated by one another. And so I like to think of an all hazards approach as one that is more integrated, that is more circular, where one may contribute to another. So for example, a natural disaster may then link to, cause, or exacerbate a human caused disaster. We saw this during Hurricane Harvey. The tank farms along the ship channel, many of them were not fortified to withstand the heavy rainfall. And so they literally sunk. And as a result of that, created a human caused disaster. It was caused by lack of fortification of the tank farms. The tank farms were not, they didn't have the infrastructure to withstand the rain, and then they created chemical leaks. One of the most significant human caused disasters we are managing right now is the disaster of climate change. This is a human caused condition, and it is contributing to more severe natural disasters, which is why we're seeing more severe flooding, more severe drought, more severe weather events like hurricanes. And that's another good example of how one type of disaster is exacerbating the other type of disaster. And that's why it's important, as we plan, as we educate patients, we are always considering these disasters together, not separately, because they may occur at the same time and they are contributing to each other and exacerbating each other as well. So with that setting of the stage, how we will be approaching the remainder of our webinar, I want to transition to our first speaker, Dr. Vian Nguyen, who is an OBGYN practicing here in the Houston area and will share a truly remarkable story of how disasters and the work and the needs of her pregnant patients came right together, and how she responded and her lessons learned from that experience. It's a truly remarkable story, and it will inspire you to prepare and inspire you to care for patients. So Dr. Nguyen, I turn things over to you.
Thank you so much, Jen. Is the volume okay? Yeah, everything's good? Okay, awesome. Well, thank you for the opportunity to speak. I think it's always important when we're learning about being proactive in our education to help our patients to be grounded in stories that can make them feel more realistic and practical. I would say before Hurricane Harvey, I'm not sure that we would have been thinking in this way of like, how can we help prepare families in the event that a delivery happens in their own home. But here we are, and we had that experience. And during that time, I was in leadership with one of the FQHCs here in Houston. And because of the position I was in, I was also part of the on-call group of physicians during that time. And, thinking back, I can't remember all the details of preparation. I would say that there were definitely opportunities looking back that we could have prepared in a much more robust way. But that's why I want to be here today to share with you some of the things that I think we, in hindsight, we could have done better. But to tell you a little bit about the story of that Jen alluded to, I remember that day. I had two little kids back then, and that we were trying to move everything in the middle of the house just in case the water came in. And I was sitting on one of those inflatable mattresses, and they were jumping on it. And I just remember taking phone call after phone call. And most of the phone calls were manageable. But then there was the one phone call of the father calling in, and lots of screaming in the background. But he was telling me that his wife was in labor, and they'd been waiting for the ambulance for about an hour, and they weren't sure if the ambulance was coming. And of course, to make things more complicated, he was speaking only Spanish, and I speak enough Spanish around someone's pregnancy, but definitely there were words that I knew I was making up. And he was just responding as best as he could to my questions. But first question for sure was, what number baby this was for them. Thankfully, it was her second baby. It just brought so much relief to me because delivering the first baby, sometimes you just don't, there's just so many unknowns. Will the baby fit? Is the mom's pelvis adequate for the baby? And so knowing that she had a prior baby and it was a vaginal delivery helped me calm down, honestly. And through the conversation, we focused on helping the mom breathe. Of course, the next question I asked was, can you see the baby? And so the baby was crowning, so that describes the baby's head is visible, and not necessarily completely delivered, but just visible on the perineum. So we really focused on breathing, and we breathed through the contractions. But I quickly had to think through what else was going to happen here. Like this could actually be happening on the phone, and in between the contractions, I asked him to go gather things. So he gathered towels, he gathered, and I know it sounds so crazy saying it now, but like anything to tie, anything off with, like shoelaces, scissors. If they had a bulb syringe, they had a 7-year-old daughter in another room. So it was, thankfully everything was fairly calm. In between contractions, he was able to pull things together. And sure enough, the head was coming, and I talked to him through some of the maneuvers, but ultimately, thank you that the baby basically came flying out. I could hear the baby's cry, and I just encouraged him to keep the baby crying so he get the fluids out, dry off the baby as quickly as possible, and then put the baby on, a mom's chest. I then had to start thinking about how am I going to tell him to deliver this placenta and make sure that the blood, calms down. And that's when all the Spanish words were just not coming to me. And thankfully, though, he quickly said, the ambulance is here, and he hung up on me. And so I had to spend the rest of the day not really knowing like what happened, but I just had to trust that the ambulance really was there and it wasn't some mistake. We ended up following up with him a few weeks later, and so it was an experience. And I think in an emergent situation like that, you always look back and you wish you had done things differently, or you wish you would have prepared your pregnant moms differently. And so in that, I would say I can think of 3 big categories. One, I think anticipating and learning from others, just like in this setting, is so crucial. And so I think, it's great for those March of Dimes and Alliance to put together a webinar like this, because we can only know about this from other people's experience and really feel like it could happen to us too. So I would say that's one category. I mean, the second thing is really letting patients know to start thinking about it. So this is a perfect time, like several months ahead of hurricane season. Like, what should they be thinking about? Some of the things that come to mind are, where do you live? If you live in an area that is just known to flood easily, where can you go during those few days that we might have some warning? It could be at a friend's house. It could be a cousin's. I mean, it doesn't really matter. It's like someone and talking about it ahead of time, so that when you have to make that decision, when we get the warning signals and signs ahead of time, that you just go. There's really no, negotiation at that point. So I think that's important. The other piece is if they're already in an area that is not super high risk for flooding, then they certainly can stay in their own home. Then what else can they start preparing for? Having non-perishable food items, having a lot of water, any medications that they may be taking. If patients are having, chronic hypertension, can you ask your clinician to give you some extra refills? Is it the baby aspirin that you have to take every day for preeclampsia prevention? I mean, the list goes on, but making sure you have what you need during an extended time, if you don't have to leave your home, is really important. The other piece I would add to that is having potential equipment that you might need, especially if you're near term. And, in my example, we didn't have any of that. And so I was just pulling stuff that I could think of. But clearly, it would be better if we had some sort of basket ahead of time prepared. And then online, there are options to buy sterile delivery kits so that, like, that the scissors are sterile and the clamps are sterile. But that's costly. And so if there's ever any opportunity for a grant to cover it, I think that would be a great use of money, for our high risk moms. And if you don't open it and you don't use it, you can, give it back and we can use it for the next disaster. But that certainly, is everything's wrapped up in a little bucket. So it's kind of nice. Um, and then I would say the last thing is, as an organization, what can you put together as resources, assuming that people can call in? And I would say for us, we knew that we had a clinician on call, and that happened to be me. But what would it have been like to have maybe a team that I could reach out to in the event that the patient was speaking another language that I could not, figure out, and or if I needed other support while helping this mom deliver, that there were others trying to call in. So forming this group, I think, is really helpful, and even giving this number or the access to this group out to those who are more in the front line, the community health workers, just because we don't have eyes out in the field. So it's hard for us to say who can we help, further. And so those were my takeaways from that experience. And I hope it just really makes things more realistic for everyone who's on the call, and that it can make a huge difference. Like those little things in preparation can make a huge difference in a family's experience and the health of the mom and the health of the newborn as well. So I'll take a second here to introduce our next speaker, Dr. Natalie Johnson, who is on faculty at Texas A&M.
Thank you so much. What an incredible story to really hear the impact that you were able to have and how that can inform, future maternal health care. Today, I'm going to focus more on some of the published studies related to research on maternal and child health effects following disasters. I am at Texas A&M University. I am an environmental toxicologist, mainly focused on exposure to air pollution during pregnancy and early infancy and what that means for health. I have no conflicts of interest to declare. We have received funding from the National Institute for Environmental Health Sciences, and we have a Superfund Research Center that specifically focuses on exposures from chemical emissions following environmental related disasters. And so this has brought us into doing work in the greater Houston area, but also throughout the United States, as my team actually was recently involved in characterizing exposure from the East Palestine train derailment. And as mentioned by the past speakers, more and more climate-related disasters are occurring. So today I'll generally talk about known effects from hurricanes, mention a case study from benzene emissions following Hurricane Harvey, and then end by talking about some emerging areas of exposure from wildfires and extreme temperatures. This photo in the next slide, I think, really just encapsulates the type of post-traumatic stress that is experienced by moms and their children following a disaster. So not only is it the, physical, biological, and potential chemical exposures, but the non-chemical stressors that can interact with these exposures and synergize to impact acute and potentially long-term health effects on moms and their children. A recent study tried to look at what are the main health effects following hurricanes, or also globally known as cyclones. And about 10% of all of these studies showed that there was an effect on birth outcomes. Now, most frequently, if you were to look on the next slide at those individual studies, there is a known linkage between a hurricane and risk for preterm birth. And, this is going to have implications, as the past speaker just talked about, for the actual delivery. And preterm birth also can be a risk factor for long-term effects in children. On the next slide, this shows an example of some of the effects that were found after Hurricane Katrina. And one study actually did find an association between the levels of housing damage and the risk for fetal death. So we do know that it's not only the hurricane, but the actual effect that it can have. So sort of the severity also can play a role in the effect. Severity of exposure is a major predictor of mental health issues among pregnant and postpartum women. So following Katrina, pregnant women exposed to the hurricane found that poor social support was associated with increased symptoms of depression, PTSD, anxiety, and stress. And what these data can show is that not only is there this linkage, but there's this incredible opportunity for prevention, especially by boosting that social support. This is not just for moms, but also for children. Youth exposed to disasters are also at risk for developing post-traumatic stress symptoms. There are certain factors, including female gender, the severity of exposure, negative coping, and again, that lack of social support were all significant risk factors for chronic trajectories across several different studies. There are the acute effects on birth outcomes, but I think it's also important to think about how it can extend. Often moms have older children, as shown, in the example earlier, and hurricanes are related to exacerbation of existing asthma symptoms. This could be due to, discontinuity in insurance, asthma-related care, or medication use, but also there could be an increase in triggers, namely mold exposure. So important in messaging to stay away from mold in homes and to make sure that you're able to get that asthma medication to ensure that continuity in care. There is a lot of emerging research as well. I won't spend much time on this, but more and more studies are looking at the impact on the gut microbiome and how the microbiome plays a protective effect in against asthma and against other types of long-term disease. So more and more research now is emerging on how can you make sure that those feeding patterns stay consistent throughout disasters to ensure that you aren't disrupting that normal homeostasis in your gut and the important protection that that can have on infants and on children. So there are all these interacting factors. One of the major risk factors for, disaster events has to do with what was mentioned earlier and that the Air Alliance is focused on is what this means for actually emissions of different types of environmental pollutants. This could include the particulate matter, which is known as PM, those tiny particles that can go deep into the lung, cause a lot of inflammation and oxidative stress on pregnant women and on their children, and also the chemical pollutants. So I wanted to highlight some of these specific examples of particular matter and of benzene exposure following acute disaster events. And I believe in this next slide, you can see an example following Hurricane Harvey. This is showing the Manchester community that's located nearby the Valero refinery. And high levels of the carcinogen benzene were detected following one of the collapses of the tank due to that heavy rainfall. Mobile monitoring, which includes the ability to drive street to street, was conducted early by a private firm and found elevated levels of benzene that were higher than what some existing guidelines were for known safety for pregnant women. Now, this was followed up by the US EPA. And in the next slide, you can see the EPA did driving more extensively throughout the Manchester neighborhood and showed that levels were reduced. Again, following that incident of the ITC fires, levels of benzene were very high. Often what was hard is that moms didn't necessarily know when those levels were peaking. And benzene is important because it is a known human carcinogen. It can pass from the mother's blood to the fetus. Animal studies show that this leads to effects on low birth weight, delayed bone formation, and bone marrow damage. Benzene is also known to affect the immune system and can increase risk for infection. So some of the main take-home messages for if levels of benzene, for instance, after the ITC fires are known to be elevated, is to actually make sure that residents are sheltering in place and able to reduce their exposure to known elevated levels of pollutants. It's not only from hurricanes though, so I did want to spend a little bit of time talking about some emerging exposures, including the increased incidence of wildfires. And we may not necessarily have the wildfires in Texas that you often will see, for instance, in California. However, smoke knows no state boundaries. And even last week, we had many hazy days throughout the state of Texas due to burning that was occurring and the wind that would move the smog into residential areas. So I think this is something that we have to be very cognizant of. Wildfire is a complex mixture of both gases as well as the particulate matter that I mentioned that can be categorized into very coarse particles known as PM10 that can cause a lot of upper respiratory irritation, as well as the PM2.5, which are those fine particles. There are several known health effects from PM10 and PM2.5 on pregnancy and on children, mostly related to infant low birth weight and preterm birth. And so these studies shown here in the table show that there are several specifically for wildfire exposure, showing exposure during pregnancy leads to reductions in infant birth weight, preterm birth, and small for gestational age. There are several effects on children as well, mostly related to respiratory disease. This could include exacerbation of asthma, risk for bronchitis, and risk for upper respiratory infections. Research in our lab shows it's not only children that are at risk, but also pregnant women. And we've looked at studies showing how smoke can actually suppress the pulmonary immune system, making moms more susceptible to viral infections such as influenza. So if able to escape the acute effects of the smoke, there are several strategies to reduce exposure, mostly one, staying indoors, making sure that there's high efficiency air filtration. More and more, it's recognized the importance of having clean indoor air in addition to reducing outdoor air pollution exposure, making sure that you're inside a place with good, clean air. The use of respirators could be recommended, but those are going to have a lot of caveats as well. So what one of the main take-homes may be to kind of reduce the strenuous activities outside. The state of pregnancy itself is going to impact the airway physiology and perhaps have an increased deposition of these particles. So it's really important that women are able to find a place to have reduced exposures to this smoke inhalation. And then in the last couple of minutes, I would like to just touch on the new emerging factor of heat. And I think we all experienced this even last summer. Heat can have complex interactions as well, leading to more high ozone days, but heat itself, especially extreme heat, is known to have several linkages with effects on pregnancy. We are starting to see more and more intense heat waves and longer of these heat waves. Gestational heat exposure is a well-established teratogen from animal studies, and there's growing studies suggesting that human pregnancies are at similar risk. Several reviews show that exposures to both extremely high and also extremely low temperatures, particularly later in gestation, are associated with risk for preterm birth, stillbirth, and reduced fetal growth. All things that need to be taken into consideration as we continue to live in this changing environment. For children, of course, as well as moms, there can be heat-related illnesses, dehydration, diarrhea, digestion disorders, increased risk for infectious disease, asthma, wheeze, or injury related to these extreme temperature exposures. And this often can synergize with other socioeconomic factors. We know in several what's called environmental justice communities, often communities of color, are disproportionately exposed to air pollution and have a higher burden already of chronic respiratory disease. These communities are often at risk for environmental contamination events. These could be hurricanes or also man-made disasters. So it's important to think about all of these exposures kind of in totality whenever designing prevention plans. So 2 more slides will show sort of summaries on both maternal health and then on children's health. Climate change is impacting heat waves, wildfires, and these extreme temperature events. This can lead to an increase in air pollution exposure and can have several psychological impacts as well related to stress and mental health. All of these have been linked with adverse pregnancy outcomes, mainly related to low birth weight, restriction on fetal growth, and preterm birth, providing many, many opportunities for preventive interventions. Likewise, on the following slide, several of the effects directly on infant and children's health are known related to temperature, extremes, air pollution, wildfires, flooding, drought, and hurricanes. These can include an increase in those pollutants and can have direct effects on development of the airways, increasing risk for asthma development, exacerbation, infections, and other types of allergic diseases. So it's very important to have mitigation and adaptation strategies to protect moms and their children from these climate hazards. And with that, I just want to leave in all of the materials. These are the references if you want to look into any of these studies in more detail. Thank you so much. I'm going to now turn it over to our next speaker, Rosalia Guerrero from the Texas Epidemic Public Health Institute. Thank you.
Thank you. Hi, good afternoon, and thank you so much for our previous presenters. This has been incredible information so far. And so I will move forward with this talk will be on resources for maternal child health. But first, a little bit about us. I'm coming to you from the Texas Epidemic Public Health Institute, where we're working to keep Texans safe and preparing during the next outbreak and hopefully preventing any future pandemics. We are housed at the UT Health School of Public Health in Houston, and I am director of vulnerable populations. And I'm also a certified community health worker instructor, work with community health workers for many years. So I'm so happy that I get to bring my two loves together today, talking about preparedness and community health workers. So I'll move forward to share what can happen during and resources that moms and agencies, pregnant and lactating persons, and everybody, right? But particularly when we're talking about pregnant persons and lactating persons, as we saw, you never know when an emergency will strike, right? So it's very important that ourselves, our sisters, our neighbors, our community members have the knowledge and be as prepared as possible in the case of an emergency. So I know a lot of times when we're going to baby showers. We're always talking about names and clothes and all kinds of things. So maybe this is the time to enter some information about preparedness and asking folks what they would do in the case of an emergency. And as we can see, it seems like there's an emergency happening or disaster happening in the Houston region practically every other week. So something to really keep top of mind. Unfortunately, during a disaster or an emergency, whether it be water or smoke or chemical, you might need to leave your home very, very quickly. So you won't be given, you might not be given a lot of head time um, uh, so that you know when you need to leave. So that's not the time to start asking yourself where one would go. So you should have a plan, get a list of shelters that are near you, and also and or near the hospital you plan to give birth in, just in case. So now's a good time to kind of like take out that map, and you can go, if you text shelter and your zip code to the number 43362, you will actually get a list of shelters. If you call 211, if you go online to your local health department under in the uh, preparedness or disaster department, also at the state, you could get a list of shelters, map them out, see who's near you, see who's near your hospital. As far as a person, agencies, what can we do? There's a lot of resources that are available for those that are either working in shelters or setting up a shelter. So again, now is the time when we should always be in preparedness mode as to how can we make our shelters more inclusive, our spaces. And sometimes these shelters can be a church or a school. So we need to think ahead of time. The good thing is there are some very good resources out there. CDC has this emergency for infant feeding. I think Jen mentioned it at the very beginning. Sometimes during a disaster, there'd be lack of water. You might not be able to have clean your supplies very well. So this should be top of mind. This should be a priority in any kind of shelter situation that babies and moms have access to clean water, an ability to wash their supplies, to wash their hands. Also, privacy is a priority. So, setting up little shelters within the shelter. Some tips on feeding infants safely. Um, of course, it's always important. We have to be cognizant of babies, moms, and infectious disease. They're in a very vulnerable state, even in the best of conditions. So during a chaotic event, it's really important just to make sure things are just as clean as possible. That means washing hands all the time. When you're preparing formula, again, to access to clean water. You may not have your pumps available. If you have an electric pump, you might not be able, there might not be electricity, right? So learning how to express milk by hand. If someone is breastfeeding, ready, having, when you have your canned items, coming up on the hurricane, having just some ready to use formula, not the powdered kind, but just a few cans of formula in the case of an emergency. And again, always being able to clean feeding items, super important. For help, for preparedness, there are resources. There's a number there for the state breastfeeding center. Like with any other disaster or being prepared, just signing up for those emergency alerts to know which emergencies are in your area and making sure those alerts come to your phone so you are aware. Sometimes we're not always watching the news. A lot of us try to stay away from the news or from the TV. So maybe going to some of the, having that alert to make sure it comes to your phone. There's also another great resource that was used a lot during Hurricane Harvey when people were not able to get to their supplies or pack a lot with them. The Houston Diaper Bank is available all year round. So if someone qualifies for WIC or Medicaid, they have access to the Houston Diaper Bank. And always remember, a part of preparedness includes immunizations for moms, because if you have to evacuate and you're going to be forced into a sheltering situation, you'll have very little control of what happens around you if people can come in with different health conditions. So protecting yourself by being properly immunized would be really important. And all those immunizations are covered under Medicaid and CHIP. So next time there's an appointment with the doctor, I would bring that up. And if you have any need any kind of information or like to follow up with us, anything having to do with preparedness or infectious disease, please give a shout out. We do have a training online for community health workers and others that's certified for continuing education. So you might want to check out our website at tepi.texas.gov. Okay. And thanks for your time and thanks for all the information. Oh, sorry. I guess I'm presenting our next presenter. Thank you so much. Looking forward to this next presentation by the Houston Health Department and our senior staff analyst, John Fleming at the Public Health Emergency Department. Many, many years of experience in preparedness and disaster planning. So looking forward to his talk. Take it away, John.
Great. Thank you, Rosalia.
You bet.
I feel like I'm surrounded by some very excellent peers here. Everybody that's come before me has done an excellent job. I've got 10 learning objectives here. I'm not going to go through each of these, but one, I want to make sure that we do have a common definition that we're working from for this MCH population. I'm going to focus more on those pre-emergency steps or protective measures that we want our community health workers to be promoting with clients that they interact with who fall within this MCH population. And probably the biggest thing I'm going to do is have three of our programs here at the health department kind of self-promote their programs. So we'll do that fairly quickly. So on the definition, we're primarily talking about families and households that have children under 5, or a mom who is expecting, or a mom who is postpartum. I do want to emphasize, this sounds like it's just about the women and the children in these households or families, but it's also about the supportive role that men and other partners can have to recognize what some of these concerns and issues are, and to provide proper support, especially around preparing for and getting through emergencies and disasters. So just again to clarify the scope, we're talking about households with children 5 years and under, or moms who are expecting or breastfeeding, or who are postpartum. Any of those conditions that are met, that entire household or family unit would be considered our MCH population. Next slide, please. So I do have a couple of preparedness capabilities and some protective measures that we want to consider, particularly for the MCH population. So I'm going to sort of do this backwards. The two things you need to be able to do in the Houston area is to be able to shelter in place, other terms that mean the same thing, or hunker down, or hide from the wind, or isolate, or quarantine. Those are all shelter in place type of actions. The other piece is to recognize when you need to evacuate and shelter away from your normal home or remotely shelter. So those are the two things we really push in our preparedness messaging. You have to be able to do both. And then the considerations specifically for the MCH population and those protective measures are, consider that you want these clients to be engaged in prenatal care, taking their vitamins, they're taking their folic acid, they're managing their nutrition, all those things that are going to lead to a great birthing experience. And then once the child is there, that the whole family is involved in cocooning and protecting those newborns, and the immunization strategy is to ensure that the child is fully immunized by 2, and that cocooning piece is really around making sure that the entire family unit and friends are also partaking of those immunization strategies, so that they're not introducing disease to the unprotected newborn. And keep in mind that newborns, even if they are immunized, are not going to be fully protected for quite some time. And then also that both mom and children are going through those scheduled well checks or wellness checks. And the next piece is going to be around those supportive programs that I really want our community health workers to be comfortable promoting these when they're appropriate to people that they encounter. And on the cocooning, I want to really emphasize the importance. We have been talking about COVID and flu and RSV quite a bit the last little while. Also for these infants, pertussis is a concern as well. So we want to make sure that all these family members that want to see the new baby, we want to make sure that they're vaccinated so that they're not introducing the diseases to the newborns. I've used a number of acronyms here. So WIC is Women, Infants, and Children. HFH is Houston, Healthy Families Houston. NFP is Nurse Family Partnership. And then there's SNAP and the TANF Temporary Assistance for Needy Families programs. All of these are supported at either the state or federal level and offered by local health departments like Houston Health Department. And the way to access many of these programs is just by calling 211, and a person can determine if they're eligible by starting that process with 211, or they can call in the city of Houston 311 or the health department call center at 832-393-5427, or visit our health department website for family child health services as listed there. And with that, I'm going to ask our team to give the promotional speak on first Nurse Family Partnership. Keisha, go ahead.
Good morning, everyone. I'm Keisha Bowers. I am the Chief Nurse and Nurse Supervisor for Nurse Family Partnership Sunnyside. We have 2 locations, one in the Sunnyside community and one in the Acres Homes community, but we serve the entirety of the city of Houston. So the goal of Nurse Family Partnership is to improve pregnancy outcomes and child health and development, as well as improve the economic self-sufficiency of families. And the next slide will explain how we do this. We have specially trained nurses who are bachelor's prepared nurses who have either had a background in OB and PD, maternal child health, home health, or other areas of nursing. Each client is provided a nurse to follow them from the time they enroll in the program during their pregnancy until the child turns 2. There is an extensive and compelling evidence that was created that contributed to creating the curriculum for the Nurse Family Partnership Program. And that came out of an extensive research that was done that started in Colorado at the National Service Office, which is our national partner. Again, we service these clients until the baby turns 2. And through research, we've identified that the first 1,000 days of a child's life significantly impact their overall health and development for years to come. Next slide. So in order to be eligible for the Nurse Family Partnership Program, the client must be a first-time mom with no previous live births. And we do emphasize live because we realize that some moms may have had miscarriages or terminations or even other instances that may have occurred. So we want to make sure that we do catch those moms who could possibly slip through the cracks just because it's not their first pregnancy. So we do emphasize first-time moms who with no previous live births. They have to enroll before 28 weeks gestation. We do like to get them earlier than 28 weeks, just so we have time to provide the education that is necessary for them to have a successful pregnancy. There are exceptions to that rule if we encounter a client that is interested in enrolling in the program and they're greater than 28 weeks, but have not delivered yet, and they have extenuating circumstances such as gestational hypertension, pregnancy-induced hypertension, gestational diabetes, or a high-risk pregnancy. We have the ability to reach out to our national partner to request a variance to enroll those because we have found that intervening, however quickly that we can in those instances also helps better outcomes. So we do have a caveat for that. The clients that enroll in Nurse Family Partnership with the City of Houston have to be living within the City of Houston city limits. And we also have the ability to reach out to some of those close areas that may not be Houston, but still considered Harris County. And then lastly, our clients are eligible if they are eligible for WIC and Medicaid. Next slide. To reach us, you can complete a referral form and send it by fax, email, or you can using this email here, nursefamilypartnership@houstontx.gov. We don't have to have all of the screening information. If you know they're a first-time mom and they're not 28 weeks, we'll figure out the rest. You can fax it to the number listed there or also use the referral link. That's the bit.ly link there. And then to reach out to our Texas Outreach and Referral Line, that information is there as well. There are other Nurse Family Partnership programs within the state. I think a little over 28, if I'm not mistaken, programs within the state of Texas. So we do from time to time have clients that transfer to us from other NFPs throughout the state in the United States. And we also try to transfer our clients when they relocate to another NFP so their services can continue and they don't have any lost time. Next slide. Oh, well, that's the end of my spiel. I will turn it over to Ms. Japira Gonzalez, who will be the presenter for Healthy Families Houston.
Good morning to you all. My name is Japira Jeffrey Gonzalez. I'm the Senior Counselor and Outreach Specialist for Healthy Families Houston. So for us, a lot of people don't know what we do, or they sometimes think that we're also NFP. So we kind of pick up where NFP, or we cover where NFP may not reach. And we also specialize in moms ages 14 to 19. Those moms typically may not know or may not seek care before 28 weeks, so that's absolutely important. We are also a free program. We don't require the Medicaid, so we try to encapsulate everybody that may not be able to qualify for NFP. The staff that provide services from us are those who have gone through training, are not nurses, but more so social workers. So our program aims to have to provide services for for children until they're 3 years old. Our main goal is that parent-child interaction. We also provide resource linkage as well as making sure that we're having healthy birth spacing and also making sure that moms and babies, as John mentioned, are getting their immunizations. Next slide. We use one curriculum, which is the Great Kids, but we also do track milestones in case we need to refer out to things like ECI. We also do depression screening, and these are all things that we want to do to make sure that the family in total and not just the child is provided for as far as development or mental health concerns and resources. We also like to do goal plans and service plans so that we're making sure that the parent is achieving something or working towards something that they want to do within the time that they're in our program. Next slide. For us, we have an email, and this is also our program phone. I will also link in the chat our referral link, which is fillable, that you can send to this email. Please do get permission and let the client know that you do plan to refer them, so that way when we contact them, it's not unexpected. Next slide. I'm going to be passing to Zara Coupe for a WIC.
Zara, you're on mute right now, ma'am.
Sorry. Good morning, everyone. I'm Zara Kupai. I am the WIC Bureau Chief. We are, of course, women, infant, and children. We serve to ensure the health of low-income pregnant women, postpartum, and breastfeeding women, infant, and children up to the age of 5 who are at nutritional risk by providing them nutritious food and making sure that they get the counseling, the nutrition education, and the breastfeeding support that they need, as well as we do social referral beside the clinical referral. I'm going to share some of the pictures that we have from our, sorry, this is taking me a little bit.
And so I feel like I can show them.
Yeah, please do that for me. I appreciate it. Thank you. So, we are one of the largest WIC agencies in the Houston area, one of 4. And I remember during the Harvey hurricane and the storm, we were the first to open. I think it was on the first day after the Harvey hurricane. And we operated not only in George R. Brown, but also in the grocery stores. We went to the client where we could meet them. We went to Fiesta, we went to Walmart, as well as opening up all of our WIC side. Next, please. And as you can see, our registered dietitians or breastfeeding counselors or nutritionists or IBCLCs, international board certified lactation consultants were everywhere. We got formula delivered to us through the formula company through the state. They were able to supplement us by bringing laptops because we didn't have enough laptops at the time, believe it or not. They hand deliver them to us. So we would be able to serve the clients and the community that were in desperate needs. And as you know, everybody just left by the clothes on their back. And so we were able to not only supply them by the formula that the state provided us because the grocery stores were running out of formula, but also give them the breast pumps that they needed so they can continue breastfeeding their babies and pump milk because it was much safer than trying to feed them formula. We even were able to get bottles and nipples and water so babies would be getting safe feeding through feeding if they weren't able to breastfeed. And just continued for more than, I think, 3 weeks serving the community within the grocery stores because a lot of the community was misplaced and they had nowhere to go. And as you see in the pictures, it was much needed services. Not only during disasters like hurricane, we are there for the community. If you all recall the formula recall, we were there step by step with the participant, and we had a great networking relationship with the grocery stores. So we were able to help our participant to get what they needed so they can be able to feed their babies and also their children who were in need of special formula. You can see our call center information on there and all of our sites that are scattered throughout the city of Houston. Thank you.
So just one last reminder on those programs. You can call 211 to access them, or 311 at the city, or again, the Houston call center at 832-393-5427, or via the link. For the rest of the slides, we're going to talk about just more or less general preparedness. Most of this is readily available through ready.gov or Ready Harris or Ready Houston. I'll share those links as well. Our mantra here in Houston is make a plan, build a kit, stay informed, and know your neighbor. Things to consider for making a plan with your family is those two decisions, whether you're going to shelter in place or evacuate. Make sure that you have all of the important contact numbers. I know all of us depend on our smartphones to retain this stuff. You really need to have things written down as well. And you should have a friend or a family member who's not living with you, but is familiar with your emergency plan as well. And that, I think, is even more important for households that are in this MCH population, particularly for those expecting moms, so that they have a good sound plan for what to do, especially if they're coming into, say, hurricane season and their due date is also approaching in kind of the same timeline. Make sure you're backing up all of your power devices like your cell phones, carry extra batteries for those to keep them charged. Establish that it's an emergency meeting place. We've shared the sample tool from NFP, and also if you go back to the very beginning of the chat, there's an MCH Emergency Preparedness Toolkit published by Federal Health and Human Services and ASPR. That link is right at the top of the chat. Want you to discuss potential types of emergencies with your family unit and other caregivers or other support systems that you may have. It's really important that people actively start planning for potential emergencies. We've gone quite a while without having any major flooding in the region or any major natural disaster aside from COVID and of course the recent river flooding we've seen. But so I think a lot of people have stopped doing that kind of preparedness, and we know it's much it's very likely that we will encounter flooding or hurricanes, and this season is touted to be a very active season. Not that that really matters, because all it takes is one storm, but I think we're sort of overdue. For your build a kit considerations, you really need to think about what are the special considerations given the family unit's maternal child health situation. Consider things like when do they due? What kind of items do you need to have on hand? That go kit that the doctor was talking about earlier, making sure that's ready to go. They have maternity clothes, baby clothes, clothes for the children, all of those dietary concerns as well. We mentioned water a lot. If you're going to be reconstituting formula, it's not enough to just have bottled water. You want to make sure you're using distilled water, something that's going to be safe for the child if you're not able to properly boil the water ahead of time. So those are, I think, extraordinary considerations specific to the maternal child health population. And there are certainly with children under the age of 5, other considerations around things like potty training. Is this child transitioning from wearing a diaper to wearing underpants, or do they have other needs? What's your plan for disposing of that waste, especially if you're not sheltering in place at home, but you're on the go evacuating or sheltering remotely at some other location. Water consumption, I think a lot of people are taken aback by just how much water is needed per person per day. The standard is that 1 gallon per person per day. Again, you have to account for how are you going to use that water. If you're going to use it to reconstitute formula, then you need to either be able to boil it or be able to access a more or less sterile or distilled product. For those newborns. Consider battery-operated devices like radios and power packs for both those devices, as well as your communication devices like your cell phones, canned goods. Can't stress enough the ready-to-eat formula or ready-to-feed formula. And as Zara was talking about, the bottles and nipples and bags, breast pump, batteries. If you've got express breast milk, a means to keep that at proper temperatures, refrigerated. Next slide, please. Food safety is really important as well. So if you're going to keep things below 40 degrees, keep them cold. And if you're going to heat them up, make sure that you're heating them up to appropriate temperatures and holding them, if you're holding them warm, at 140 degrees for any period of time. If you lose those temperature controls, then you have to consume that food within 4 hours. Otherwise, you run the risk that the food becomes more of a breeding ground for bacteria and a potential for food safety concerns and foodborne illness. An earlier slide mentioned signing up for alerts, and we provided that useanemergency.org alerts page. Here I'm also providing the one for Harris County. Harris County does have a lot of resources that include sign language. So if you have members of your community who are deaf or hard of hearing and use sign language, it's really important that you consider their different communication needs as well. Make sure that you're instructing these clients on how to stay informed, who the trusted resources are or trusted sources are for that communication, and when they're hearing different stories, which which storyline to trust. Hopefully that's the city or county entities. Consider different support needs for this population, such as childcare, the doctor visits for both mom and the child. There are different employer expectations you need to consider as well. I come from Canada, so in Canada there's a much longer maternity leave. Unfortunately, here in the U.S., there's people having to get back to work much more quickly. And then consider those dietary needs. Move along a little bit quick here. So your summary is make sure that you have your current prescriptions. Think of ways to keep that extra 7 to 14 day supply of medications on hand. I know this is a difficult thing to do, but it is possible. If you're getting 30-day refills, you can have it typically refilled right around that 21 to 23 day mark. So if you do that a couple of months in a row, that would give you your 7 to 14 day supply to keep on hand. We talked a little bit about the Go Kit or the Go Bag for pregnant mom, but also think about the diaper bag that mom will be carrying or dad will be carrying, and consider having a second one of those ready to go. Think of activities to keep your child engaged and amused, especially if you're going to be sheltering remotely, so you may not have all those resources that you're used to in terms of toys and whatnot. So make sure you pack some of those things for your child. Don't forget medical devices like your breast pump. You should have a thermometer. If you're diabetic, your glucose meter. If you use CPAP, consider that as well. If you have hearing aids, the batteries for that. Basically any kind of durable medical equipment that may not necessarily be specific to the MCH population, but there might be other members in the household as well, especially if they're staying with their adult parents or grandparents. And make sure you're engaging all of the dependents in this planning process. So we now have multi-generational households. Make sure that everybody is planned for and informed on what these emergency plans are, and make sure you address both shelter in place and evacuation. If you're relying on a caretaker, they may be impacted, and that support may not be available during an emergency or disaster. So you may have to have a backup plan for that. And some of these are more for our disability access and functional needs population, but a lot of these things still apply for our MCH population. And it's really important that we use a whole of community or whole of household approach as we prepare for these upcoming emergencies. And I want to address this QR code that's up here right now. When I built this, the intent was to be able to share stuff via Google Drive, and then the city has dropped support for that. But since I've published the QR code here, I will dump some files into that so you can readily access some more materials, including the link I put in the chat earlier for the ASPR MCH Emergency Preparedness Toolkit. That's a very good resource. They also have a great list of trainings that are available, which again, I'll share through that QR code. And last but not least, I want to thank all my colleagues for supporting building this presentation, especially Norma Atherton for all the preparedness pieces that she put in here. April for providing the inputs on Healthy Families Houston, Mary, and not mentioned here is Keisha, who actually presented on Nurse Family Partnership, and Zara. Thank you so much, Zara, for working with me and putting this together very, very much last minute this morning and adding in your slides about the WIC response during Harvey. I think that was very informing. Thank you all so much.
Well, thank you to each and every one of our presenters. I have learned a lot of information. I am sure that you have learned a lot of information as well. And I'm so thankful that everyone spent about the last hour and a half with us as we talked about what is important to know about disasters and all hazards approach? And disasters don't just include hurricanes, as we heard, and those effects that it has on our families, on our pregnant individuals, our moms to be, their babies, and then children, those long-term effects that we know are out there. So please help me give a huge round of applause to all of our presenters. Their names and information will be on the slide deck that you get, as well as a resource listing, as I said, that is an easy 2-page at-a-glance section that will have links to it so that you don't have to comb through every single slide in order to get that high-level information. But as we come to the close of our time together, I don't see any questions in the Q&A or in the chat. But again, our presenters are available and they're happy to talk to you offline. But we are going to ask you a couple of poll questions. And so we've just spent the last hour and a half together. What are the impacts that we have seen on maternal health outcomes with regards to disasters? You can select all in this particular poll, so feel free to join us in what is your knowledge, and I will be able to share the response. I believe I'm able to share the response. Get a couple more people to answer. We're climbing in our responses. We have 22 folks who've responded. If you are seeking community health worker credit, if you're not able to answer the poll through that poll mechanism that I launched, feel free to just type your response in the chat, and I can do a little bit of correlation on the back end. But those impacts to mom, those impacts to her as she is pregnant, what does that look like? What applies to her? So I am going to, let's see, the response details. You should be able to, oh no, you can't see that. Let's see, again. I guess I can't share the responses with y'all. Teams doesn't let you do that. Things you learn every single day, y'all. Well, if you select every single one of those maternal health outcomes, we are seeing pregnancy loss, additional stress that is applied to mom, preterm birth, the birth of a baby before 37 weeks, as well as increased postpartum depression in that after effect. That is what we are seeing with our moms. Now we're going to look at what do we see as a result with our children, those health outcomes for our infants. What are we seeing? What is happening, the impact of disasters that are resulting during pregnancy. So what mom is experiencing while she's pregnant. What do we see as happening with our kids, with our babies, with our infants? And again, those longer effects that are happening as we see our children grow up during this disaster season. And as someone did like to remind me when I was talking with her, she said, anyone who was born since 2020, we were in COVID for a long time. We are still in a pandemic. So that is contributing to some of these infant outcomes we're seeing, which if you select it all, interruption of infant feeding, asthma, mold exposure, all of these impacts we are seeing on our infants and babies. Okay, third question, promise we're getting there. For preparation, does preparation include keeping both children and adults up to date on their immunizations? Let us know. What do you think? Does that preparedness include getting immunizations on the schedule as the Centers for Disease Control has set forth? What do you think? Oh, yes, I love it. Everyone who's replied, 100% so far. Congrats, y'all. Yes, absolutely. It is important for everyone to be immunized. And then finally, this last question, as we consider our build a kit, plan a kit, plan a response, build a kit, what do we need? Our families who have babies and infants, what should they consider keeping with them and have ready for an emergency? Select one, select two, select all. Absolutely, seeing those responses that are coming in. As you heard, it's really important to keep distilled water specifically for our infants. Bottled water isn't just going to be enough if you don't have a way to heat that and to distill it. So distilled water for our families and the importance of that. So if you selected all of these, ready to feed formula, not just the powdered formula, but that formula it's already created, already made. And then if mom is continuing to breastfeed or lactate, a breast pump that operates on batteries, because we know the electricity is not always available. So again, thank you so much for all of that. I think everyone gets an A+ in the answers to our poll questions. And as we close, as I kept you about 3 minutes over, we have 2 upcoming trainings specific for community health workers. We will have one on early relational health in October on mental health, World Mental Health Day, that's sponsored by Community Health Choice and will be facilitated and taught by First 3 Years and our colleagues over there. And then we are so excited to bring you an Environmental Justice 101 in November, sponsored by United Healthcare Community Plan of Texas. And we have a fabulous lineup for that we're going to talk about. A couple of different things. We'll go into a little bit more depth from what you heard today. So thank you so much for joining us today. This is my contact information. If you are not sure how to get in touch with me, please feel free to email me. I will get out those certificates within the next 2 weeks for those who want CHW training, continuing education credits. Certainly appreciate your time today. Again, thank you to all of our speakers, to Jen Hedaya, to Dr. Vian Nguyen, to Dr. Natalie Johnson, to Rosalia Guerrero, as well as all our Houston Health Department friends, John Fleming, Zara Gopai, Keisha Bauer, and Japiria Jeffrey Gonzalez. Thank you so much for being here. If you do not have to leave, happy to stay on and answer any questions you might have, but otherwise wishing everyone a happy Wednesday.